Hi, I'm Dr. David Haase, and you're sitting here in MaxWell Clinic's neurotherapy room. I have been convinced from very early on in my medical practice that the brain is central to health. And depending upon your ability to access your brain's highest potential, that is to the extent to which you're going to be able to access the rest of your body and your life experiences potential. So I started very early on trying to figure out what kind of objective markers could we find that can understand this most complex structure in the known universe, right? It's crazy in psychiatry that there's no tools used to examine the organ that they're treating. And so we found quantitative EEG. We became one of the very first clinics to do this in the United States in a clinical facility. And that's where we take the shower cap looking thing, gets put on the head. I might even just do this here. How about that? Woo! And it gets fitted much more professionally when you're having this therapy done. But each one of these little holes gets filled with some gel, and that gel then creates a bridge between the electricity your brain is making and our sensing devices. And so we're able to measure the brain waves that go on, and then we feed all of that information through multiple computer software packages and databases that have been created from individuals with high performance or healthy brains. And then we can see on a piece of paper on our screen in two-dimensional and three-dimensional ways what parts of the brain are inefficient. It turns out brain inefficiency is all over the place. And it comes from genetic challenges, it comes from experiences, it comes from nutritional challenges, it comes from head injuries. But the good thing is the brain is designed to learn. The brain can change. And there's a saying, neurons that fire together wire together. So no matter what you do during your day, you're developing a brain today that's going to enable you to do that thing better tomorrow. So we take advantage of that. And one of the therapies we've pioneered, again, one of the first functional and integrative clinics to integrate this in the world, and that is to do neurofeedback. And neurofeedback is essentially like physical therapy for your brain. And it is a learning tool where we teach your brain how to be more electrically efficient. It's a very simple process. We put a cap like this on and you watch a movie. And when your brain waves do what we want them to, what we've figured out after doing our diagnostics that would be most beneficial to change, if your brain moves towards what we want to reinforce, the movie plays bright and loud. And if your brain waves go away from what we want you to continue to do in your life, the movie gets dark and quiet. And the brain wants to watch the movie. And so your brain figures out a three-dimensional electric combination lock to play, to fire, so that the movie plays. And because neurons that fire together wire together, you become more electrically efficient in those areas that we are training. And the great part about this, what I love about neurofeedback, is that the longer you do it, the less you need it. That's the mark of a great therapy. That is absolutely the mark of a great therapy. It can help individuals with mood challenges, with attention challenges, with even memory challenges, so you don't have to write things on your hand. And it works with individuals that have traumatic brain injury. That's amazing, actually. I started doing this work largely because I started the clinic in Clarksville, where we were close to Fort Campbell military base, and our soldiers were coming back from Iraq and Afghanistan, and they were injured in their brain. And this has given so many people their lives back. So we're very proud to be able to do this. And we have many different software packages. We have many different technologies. We have direct transcranial direct current stimulation. We have photobiomodulation. it's very important to customize the neurofeedback to the person. And it's one of the things that's very unique at MaxWell Clinic. I hate the idea that if your only tool's a hammer, everything's a nail. We have a massive toolbox here, and we try to make certain that we do our very best to match the right tool for the right job, and honor the person, the patient that we're treating. So I encourage you to discuss this with your MaxWell Clinic clinician, that you would better understand how this could help you with a current brain challenge, or even optimize. We have several people come to us that just want to have a 2 or 3% increased advantage in their brain. And if you think about what would a 2 or 3% improved performance in your brain do over the course of a lifetime, that's massive when that compounds, because just like money compounds for as regard to interest, the more important and more valuable thing is brain efficiency compounds. When you make a more efficient brain today, that is the brain that's going to learn and take you into tomorrow. And those changes start to build on each other for a better future. So wish you well. Take care.